Dermapen treatment. The indications for use during this treatment are skin rejuvenation, skin tightening, reducing fine lines and wrinkles, improving texture and improving skin tone and color. Preparation phase. Before the Dermapen treatment, please have your patient observe the following. No retin-A products or applications for 72 hours prior to treatment. No autoimmune therapies or products 72 hours prior to treatment. No prolonged sun exposure or sunburns to the treatment area 72 hours prior to treatment. Skin should be clean and makeup-free. If an active or extreme breakout occurs before treatment, evaluate on a case-by-case basis. Before starting the Dermapen treatment, be sure to read the procedure manual and consult with your patient for a complete skin evaluation. During the consultation, please refer to the list of contraindications provided in the procedure manual and be sure to share the details of the treatment so the patient has clear expectations for the service. Also, because skin cells need nutrients for best function, be sure to share the patient home preparation checklist for a recommended anti-aging regimen. The first step to preparing the patient is a thorough cleansing with a product appropriate for their type of skin. Be sure to remove all makeup and debris. The added pampering of a hot towel will also increase the perceived value and enjoyment by your patient. It also has the potential to open the pores of the skin to allow better penetration of the anesthetic cream in the next step. Cleanse the skin thoroughly, and for optimal results, it is advisable to remove the decayed top layer of the skin and stratum corneum with an exfoliating treatment such as a microdermabrasion or a cleansing scrub. Once the skin has been thoroughly cleansed and/or treated with an exfoliating treatment, with a new pair of gloves on, apply Numb Master anesthetic to the entire face and treatment area. A topical anesthetic with varying percentages of active benzocaine, lidocaine, and/or prilocaine is recommended for the comfort of your patient. Be sure to read the indications on the anesthetic cream prior to application to ensure proper use. Allow the Numb Master to set for a minimum of 25 to 30 minutes. For quicker results, occlude with plastic wrap for the duration of the waiting time. Next, remove the Numb Master with gauze. The last step of the preparation phase before the treatment begins is an antibacterial antiseptic application using alcohol wipes to sterilize the treatment area completely. This will remove any unwanted bacteria still present. Treatment. Clean device thoroughly with Dermapen one-step cleaner, paying attention to the inside of the tip socket as well as the cord. Remove sterile disposable tip from packaging and insert into the Dermapen device by turning in a clockwise direction. Cover device with a Dermapen Universal Microneedling Protective Sleeve by inserting tip into the large opening of the sleeve. Slowly slide device into sleeve until the replacement tip protrudes from the small opening and the sleeve adheres to the tip housing. Remove and discard backing. Apply power source. Select speed by turning the speed dial in a clockwise direction. Be aware that the device turns off between each speed setting in order to stop the device without having to turn the speed down to the stop or S setting. To set device to a lower setting, turn the speed dial in a counterclockwise direction. Choose the appropriate needle depth for the treatment by turning the depth gauge in a counterclockwise direction. To move to a shallower depth, turn in clockwise direction. Be aware that there is a no-turn area on the depth gauge. Refer to the procedure manual for depth and speed guidance when treating each section of the face. Divide the face into imaginary sections and treat each completely before moving on to the next section. Start with the forehead and then move to the cheeks, then the nose, upper lip, and finally chin. If you wish, you can also treat the patient's neck and décolleté. It is important to keep the disposable replacement tip pointed in a downward manner while performing the treatment and at all times during the treatment session. Uniformly apply the Dermapen-approved cosmeceutical to the first section to be treated. The Dermapen cosmeceutical chosen will depend on the skin presentation of each patient and what the desired treatment is chosen to correct or improve. The numerous micro-injuries created by the Dermapen needle tip will create microchannels promoting immediate hydration and lubrication to trap water within the dermis layer, resulting in better skin hydration while simultaneously providing the needed benefits of tissue repair. It is extremely important not to make contact with the patient's skin with the applicator to ensure sterility and avoid contamination to the bottle and your patient. Dermapen has research to suggest the following protocol. Apply Dermapen cosmeceutical product to the area to be treated. Treat the area with the Dermapen following the technique set forth in this section. Reapply the Dermapen cosmeceutical product to the treated area. This protocol of applying the Dermapen cosmeceutical or active ingredient, treating, and reapplying the product is the most effective way to support trans delivery. Reactions may vary. It is important to understand each individual patient's allergic response. Begin the treatment by choosing the appropriate needle depth using the guidelines in the procedure manual. With the free hand that is not holding the device, gently hold the skin taut. With the hand holding the device, use a steady and slow treatment tempo. Use short, stripe-like motions, much like a microdermabrasion treatment, lifting the needle tip between each stripe. Avoid using a snake-like pattern where you do not lift the handpiece. The stripe motion will maximize the device's efficiency and allow the user to deliver an even treatment. Up to 3 passes may be necessary. Remember that when treating each patient, the skin goals and conditions must be evaluated. If the skin presents superficial damage or needed corrections, then 2 passes may be sufficient. However, if deep scarring is being treated or deeper wrinkles need to be improved, then 3 passes can be used. During the first pass on the forehead, exert constant pressure and use vertical passes. Start at the midline of the forehead and initiate contact at the bottom of the section and treat upwards toward the hairline. Divide the forehead into 2 parts and treat the right side and left side separately. During the second pass, exert constant pressure and treat horizontally. Treat each side starting in the midline and working laterally across the skin. If a third pass is performed, use diagonal passes starting again at the midline of the forehead and work outward. After treating the first section, such as the forehead, cheek, etc., place the Dermapen handpiece device on a sterile surface and use a gauze pad to wipe the treated area to remove any visible debris or minor bleeding. It is suggested that you have the OSHA bloodborne pathogen certification course before using the Dermapen device to be aware of the risks and safety responsibilities of working with bodily fluids. As you can see, it is not necessary to apply hard pressure. Try to avoid treating very sensitive regions such as the protuberant area of the eye and irritated skin such as pustular or nodular rosacea. Also, avoid treating moles or suspicious lesions. Please see the procedure manual for all contraindications. Refer to the Dermapen procedure manual. Here you can identify from the directionality chart each area of the face and its corresponding depth. For example, the cheek area being treated here can be done from 0.5 to 2 millimeters. When treating the chin, as shown here in the video, the procedure manual depth chart suggests a depth of 0.5 to 1 millimeter. When working the areas around the lips, be sure to understand if your patient is prone to facial outbreaks such as cold sores. If so, medication is recommended for 24 hours prior and 48 hours following treatment. The stamp-like motion shown here is ideal for use on deeper wrinkles as an optional third pass. This stamping allows for the needle penetration to be concentrated in areas where maximum collagen and elastin growth is desired. When treating the nose, be sure to refer to the directionality chart found within the Dermapen procedure manual. The direction used to treat the nose should be moving away and out from the bridge of the nose. Moving in this direction keeps the flow of blood and lymph from collecting in the venous cavity and protects against possible bruising if the needling creates any small nicks by accident. It is possible to treat the periocular areas of the eye. However, use caution and be sure to pull the skin under the eye taut with your free hand. Do not use a needle depth over 0.25 millimeters in this area. A delicate free hand can keep the skin stretched taut so that the areas such as the crow's feet are treated with maximum effectiveness and evenness. One of the many advantages of the Dermapen is that it allows the practitioner to treat small areas around the eyes without risking unnecessary epidermal damage. The Dermapen's method of virtual painless delivery creates the perfect treatment for the neck and chest. These are areas that many patients will often complain about. The dermapen will improve the appearance of these areas by creating the microchannels that increase the availability of cell nutrients and the triggering of the wound healing cascade, which brings platelets, fibroblasts, epithelial, endothelial, and immune cells together to facilitate skin tightening, color, and texture improvements. When treating the neck, refer to the directionality chart provided in the procedure manual. Start with vertical passes working from the bottom of the patient's neck toward the chin line. Next, work horizontal passes using a medial to lateral direction as your guide. It is often easier to split the larger sections like the neck and the chest into individual parts. This allows you to have more control and focus per section, making the treatment more even and uniform. For areas with more distinct wrinkling, scarring, or other issues, it may be helpful to spot treat with a third pass. Notice how the free hand is used to keep the skin stretched taut so that the treatment is done evenly and allows the needle tip to be flush and even with the patient's skin. After the entire treatment is complete, apply Dermapen PhytoBoost Serum to the treated area. Advise your client to apply this serum every 4 to 6 hours for 48 to 72 hours post-treatment. A short window of time exists to apply any actives or serums. The microinjuries created have formed microchannels, allowing the percutaneous absorption or transdelivery potential for these serums. One study suggests these channels close within about 10 to 15 minutes. Apply one of the Dermapen post-treatment masks, such as the Inderma Hydrating Mask shown here. Place the mask on the face and/or treated area for up to 30 minutes. After the treatment, apply a Dermapen-approved SPF Physical Defense Moisturizer if needed. Take precautions against sun exposure. No direct sun exposure for 3 to 5 days post-treatment. Do not apply chemical sunscreens for up to 24 hours post-treatment. Do not apply traditional cosmetics for at least 24 hours post-treatment. Be sure to educate your client on proper home care post-treatment as outlined